In today's video, I'm going to give you some of my top tips that will help you survive and thrive throughout your first year of residency. Hi everyone, welcome back to my channel. My name is Stephanie and I'm an internal medicine doctor, and I make videos on health, wellness, as well as my life as a doctor. So click that subscribe button to follow along and hit the bell so you never miss a video. As of July 1st, a whole new batch of doctors have been released into the hospital. You've finally completed medical school, you've written your licensing exams during this pandemic, and you're stepping foot into the hospital as a doctor. Scary, I know. But as someone who's gone through residency and I'm now on the other side as a staff doctor, receiving my own newbie residence, I want to give you some of the tips and tricks that I learned throughout residency that will help you survive this year. Tip number 1, it's okay to not know everything. You've literally been a doctor for about a minute now, and you're going to be faced with so many situations and scenarios that you do not know the answer to. And it's okay. It's okay to have questions, and it's okay to just not know. In medicine, there is this theory where see one, do one, teach one, and that's really what it's all about. You're going to see your senior resident, you're going to see how they react to certain scenarios, and you're going to learn from them. And that's how you're going to expand your knowledge. You're not going to know everything right now about every type of scenario and every type of medical case that you're encountered with, and that's okay. You just have to know that that's okay. And this goes into tip number 2, and that is to ask questions. This is the time right now, your first week, your first month of residency. Ask as many questions as you can possibly think of. Whether it's about a certain patient, or whether it's about how to write an order, or even if it's what rotations you should choose to take for next year, depending on what specialty you want to specialize in, this is the time to ask as many questions as you can, because you have so many people ahead of you that have more knowledge than you, and it's going to help you out in the long run. I remember having to write my first few orders as a resident on the first day of residency, and one of them, sadly enough, was for Tylenol. And honestly, Tylenol, you have it in your home. You don't really need a doctor to prescribe it. But I just felt so nervous being a doctor for the first time and writing an order without someone else having to sign off on it. And so I remember just asking my senior resident if everything I had written was okay. And you know what? The first day, I may have asked a lot more questions, but a few days after that, you get the hang of it. You get comfortable. And that's something that will happen. It may happen quicker for some people than you, but that's okay. If in doubt, ask for help. Tip number 3, and that is to read around your cases. You're going to be faced with so many patients every day with different types of symptoms, and not everything is kind of how it's laid out in a textbook. So take this opportunity to learn one new thing from every patient you see. This is going to help you expand your knowledge so that the next time you're faced with a similar scenario, you'll know exactly what to do. Sometimes when I read textbooks, it was hard to conceptualize the situation, but once you see a patient with a similar presentation, you never forget it. It actually sticks a lot more better than if you're just reading something on paper. And this kind of goes with my next tip, which is to follow up on your cases. So follow up on the patients that you admitted if you did a call shift. See how their story went and ended. A lot of the times when you're on call at night, you see a patient for the first time, you have an idea of what they have, you order some investigations, and then you move on. You may not be following them the next day, you may not know how their story ended. So what I like to do is to follow these patients and see what happened from the tests that you ordered. So being able to go back, see how their story ended, and then take that information and use it to expand your knowledge and also show where there are gaps in your knowledge will be helpful in your overall learning as a resident. Tip number 5, and this is one of the most important tips if you have to remember anything, and that is don't take the criticism too personally. As you will soon learn in residency, you're going to be faced with many different types of teaching and many different types of people who are teaching. Some staff members or senior residents are very supportive. They teach in a way that is comfortable and doesn't put people on the spot. And then you have the other people who like to challenge you in ways that may get you out of your shell or make you feel really uncomfortable at times. A lot of the times, those people use something called pimping. And I don't really care for this term, but it is a term that's widely used in medical school and in residency to really mean that they're trying to put you in your place or put me in my place, and that's what it stands for. And that is a way of teaching where you're constantly being asked questions or grilled questions until you can't answer anymore. And usually you're in front of a group of people. So it can be very stressful, it can make you feel very nervous. And some people thrive on this type of teaching and some people just shut down and are unable to learn that way. So be aware that you're not always going to do exactly the right thing and you're not always going to say exactly the right thing, but just don't take the criticism personally like it's an attack on yourself. Take it as a learning opportunity. Tip number 6, keep a balanced life. With the long shifts, demanding hours, and lots of patients, you may feel overwhelmed at times, but make sure that you continue to find balance in your life. And this means keeping up with your exercise routine, going for walks, or taking the time to have lunch with friends and meet other people. Make sure that you don't lose the balance in your life because it's going to affect your learning and how you perform at work as well. And also make sure you're getting enough sleep and having a balanced diet, because you're going to need that nutrition to help you throughout your long shifts, and you're going to really need that balance to help you survive residency. Tip number 7 is to build a support network. This can be people from your same program, so other interns or other first-year residents. This could be finding a mentor who's above you or who's a staff physician, or this could just be having a close set of family or friends who you can talk to and confide in about some of the difficulties and challenges that you're faced throughout the year. A lot of the times when I felt challenges in residency, it had a lot to do with patients who've had a bad prognosis or certain things that happened to my patients, such as a code blue, which is, if you don't know, a patient who's had an arrest and you've tried to resuscitate them, but it didn't go well. These are very emotional things that can happen throughout the year, and they do happen. So you have to be able to kind of talk it out and confide with other people so that you can actually work through these emotions. You don't want to keep it all inside because it's never good for anyone. So make sure you build that support network so that you have them throughout the year when times are great and when times get tough. And finally, my last tip is to be positive. I remember being faced with 26-hour shifts every 4th day, feeling exhausted, overwhelmed at times, but you know what? There is a light at the end of the tunnel. You're doing exactly what you intended to do when you had that first thought that you wanted to be a doctor. Going through medical school was just one step and residency is another. And trust me, I know what it's like. I'm now an internal medicine staff at a great hospital. I've never felt happier in my life right now, and even though residency had its ups and downs, it was just another stepping stone to be getting to where I am today. So always stay positive. Thank you guys so much for watching. I really hope you enjoyed this video and are going to take these tips into residency and beyond. Give this video a big thumbs up, as well as comment down below how your first week of residency went. And let me know if you have any other questions and I'd love to answer them. Also, let's stay connected, so be sure to subscribe to my channel and hit that notification bell so you never miss a video. Everyone, I hope you're doing well. I hope you're staying healthy and being happy, and I'll see you on the next one.